We are here today with Karsor Kollie, who's currently seconded to Effect Hope from the Ministry of Health of Liberia, where he serves as Senior Global Health Advisor. He previously led Liberia's National Neglected Tropical Disease Program for over a decade, and during that time led one of the most ambitious real-world tests on NTD integration, embedding case management for multiple diseases directly into the health system. His team work, published in BMG Global Health this year, showed a fourfold increase in case detection and expanded access across 71 facilities. But beyond data, Karsor has navigated the hard realities of rebuilding NTD programs after Ebola, managing donor transitions, and learning what actually works at district level versus what looks good in policy documents. He brings exactly what the country implementing perspective this conversation is meant to surface. Thank you, Karsor, for being here with us.
I've written several articles, commentaries on donor reliance. So one of the key areas that we see as very critical when it comes to sustainability is ownership, government ownership. And ownership is not just about transfer of responsibility, but it's about transferring control and capacity. So the government should have control, should have capacity. It means the capacity must be built. But more to that, governments normally will set standards. For enforcing these standards are critically important. Integration into national system like the HR, the supply chain, and some of these things I referred to before. And domestic funding is also very critical when it comes to ownership. So, and sustainability programs are not going to be sustainable only if government is only relying on international partners, because these funds will fade away, but the country remains. So one of the very key areas that I've always emphasized in some of the articles I've published on governance and reliance is for government to ensure that the domestic funding, even as little as 20,000 to 50,000 like Liberia has started, even though this is happening in other countries, but in terms of sustainability and taking full ownership, government resources are necessary to really showcase that leadership and the motivation behind the priority that is given to integration, specifically focusing on skin NTDs. So ownership begins with countries invest, even it is just modestly, like I said earlier, small amount of money and gradually increase, will show that government has ownership of these programs.